All righty, we are going to get started. Thank you all so much for joining us for Grounding Leadership and Engagement in Psychological Safety to promote a culture of equity. My name is Valerie Henderson, coming to you from the Stretch Project. This is our third national convening. We are so excited to have you all with us here today. Before we get started, we always like to do a land acknowledgement. We humbly acknowledge that ASTHO's offices are located on the traditional and contemporary lands of Indigenous peoples. Our Arlington office resides on unceded lands of the Pocastaway and Anacostan peoples, and ASTHO's Atlanta office resides on the Cherokee East and Muskogee homelands. As we gather from places across the country and globe, we pause to acknowledge the land in which we live, work, and play, to honor and demonstrate genuine respect for Native peoples, past, present, and future stewardship of this land. Together, we recognize the past and ongoing colonialism and systemic inequities that forcibly removed Native peoples from their homelands while respecting treaties made on this territory as a first and not final step towards reconciliation with Indigenous peoples. We believe that speaking truth to power is an important action towards aligning our words and actions to create collaborative, accountable, continuous, and respectful relationships with Indigenous nations and communities. Through our land acknowledgement, we hope to encourage you to take the time to research the Indigenous land in which you occupy and inspire you to act in support of Indigenous peoples. Please use the link on the screen that you see. You can enter your zip code and check the land and where you live, work, and play. We will start out with a brief welcome and introduction. We will have an interactive presentation, which I am personally so excited for, with Dr. Alicia D, and then we will close with some final announcements and upcoming stretch events.
Thanks so much, Valerie. So welcome everyone to today's convening. Before we dive into the interactive presentation, I wanted to do some level setting around the Stretch project and both of our iterations. So we are funded by the Robert Wood Johnson Foundation, and Stretch stands for Strategies to Repair Equity and Transform Community Health. The Stretch team is made up of 3 organizations brought together by Robert Wood Johnson: ASTHO, the CDC Foundation, and the Michigan Public Health Institute. The initial aims of the project focused on providing targeted technical assistance to state agencies to aid them in operationalizing equity. And while the term operationalizing equity is quite broad, this project specifically emphasized assistance in areas such as creating sustainable funding strategies for health equity work, developing and implementing an inclusive workforce, and advancing leadership capacity to promote practices and policies that advance equity, ultimately establishing and creating a culture of equity. So in order to achieve these project aims, the Stretch team developed the curriculum for a 10-state learning cohort. This first iteration of the project ran through the 2022 calendar year and concluded in May 2023. Our primary objectives for this initial cohort were to design meaningful, lasting systems change to create inclusive, equitable public health systems, embed equity into priorities, programs, policies, and practices, and leverage new funding through finance strategies to drive impact. So in preparation for working with the state teams, the internal Stretch team developed this framework, this beautiful framework that you see on our slide here, to inform the learning community offerings. So the Stretch framework is centered on addressing root causes of health disparities through a systems change approach, and is meant to reframe and reimagine current public health models necessary to achieve more equitable outcomes. At the center of the framework is addressing the root causes of inequities, such as structural racism. To fully address these causes, it can only be achieved if all 3 levels of systems change are addressed. This includes the structural level, such as policies and practices, the relational level, which includes relationships and power dynamics, and the transformative level or mental models. So to achieve these levels of systems change, we created the 5 subject domains that are interlapping and necessary functions. Community-led approaches focuses on centering community voice and equity work and can be used to address issues such as disempowerment, abuses of structure and authority, or addressing the availability of employment and livable wages within a community. Place-based initiatives focuses on work centered around a shared geographic location. So within the stretch framework, this could include addressing residential segregation, environmental hazards, food deserts, and transportation access issues. Workforce development focuses on providing the proper organizational structure and training to those working in this space in order to increase impact and effectiveness. Another component of workforce development is ensuring hiring practices are equitable, and where possible, the staff representation reflects the community they serve. Data-driven management addresses the need for more equitable collection and dissemination methods when it comes to data and equity work. Oftentimes, communities are asked to share data, but they are never told what is done with it or what actions resulted from their participation. And this can often lead to mistrust and feelings of resentment, as well as a desire to not participate in future asks. So utilizing the stretch framework, areas and data that could be focused on include data and narrative change, bias, misinformation, and cultural humility. And then finally, finance systems looks at how agencies can organize finances for long-term sustainability and success. So the finance system domain focuses on how governmental public health can move away from restrictive approaches, such as funding streams based on pre-existing silos. It encourages organizations to adopt approaches to match community needs and priorities and move away from traditional restrictive funding mechanisms. So depending on where stretch states wanted to begin their work, they could focus on any of the domains in any order they chose. And by addressing each of these domains, the end goal of the framework is equitable outcomes for all. So one of the primary lessons we learned from Stretch 1.0 was that community partners needed to be more directly involved in the work of Stretch. So when we went about developing the project's second iteration, the Stretch partners focused on centering the community partners. So in Stretch 2.0, community-based organizations were the primary applicants for each state's submission. And along with receiving funding to assist in participation, each stretch applicant is comprised of a partnership between the applying organization and their state health agency. This partnership comprises the Stretch Collaborative, who together receive personalized assistance through their core response teams. The 7 state collaboratives who are participating in Stretch, which we will shout out now, it is Colorado, Hawaii, Maryland, Nevada, Rhode Island, South Carolina, and Vermont, make up the Stretch cohort, who together participate in peer learning through the project's practical application workshops, which began in June and run monthly. The third level of engagement, which is where we are today, is open to all those working in the health equity space who would like to learn more about the Stretch project and the lessons learned through these initiatives. So, all of that to say, that brings us to our convening today. This is the third of our Stretch national convenings, and today will be centered in the workforce domain and focused on psychological safety. So along with applying the Stretch framework and hearing about lessons learned from our project, another primary goal of these convenings is to serve as connection time between health equity practitioners focused on systems change work. And with that, I will hand things back over to Valerie for some pre-session polling.
Thank you, Jessica. I noticed I was muted. We're going to go into the pre-session polling session of today's workshop. So what I want you all to do is grab your phones. You can copy and paste the slido.com link into your external browser and then enter this code that you see here. You can also very accessible through the QR code as well. Grab your phones. I'm going to give you all about 20-ish seconds to pull that up. And then I will go through the polling sessions or questions with you all. Question number 1. How did you hear about today's convening? And as you all start to input your responses, you will see them populate on the screen. So options are ASTHO promotion, participant in the Stretch 2.0 cohort, other, CDCF promotion, and MPHI. And if you do put other, if you don't mind including your response in the chat so we can kind of see where you're coming from, we will greatly appreciate that. Love word of mouth. Thank you, Catherine. Okay, we're gonna move on to the next question. Please list which state, territory you work in. So this is an open-ended question. You can put your abbreviation, you can put your full state. Awesome. I love to see all the responses coming in. Beautiful. So awesome. I love to see the array. We're all over the map. I love this. Awesome. And we're going to move right into our very last question, which says to rate your knowledge of or skill in psychological safety before today's convening. So extremely knowledgeable, somewhat knowledgeable, slightly very, this topic is new to me, or slightly knowledgeable. And you will see more of this interactive polling throughout. So I hope you all are prepared. Awesome. Thank you all so much. And I will go ahead and turn it over to our speaker for today, grounding leadership and engagement in psychological safety. Thank you.
Thanks, Valerie, and good afternoon, good morning, good day, or good evening, or good night. I'm not sure what all the times are, but very happy to be gathered with you all. As Valerie shared, I'm Dr. Alicia Justice. Alicia is fine, Dr. Justice is fine, Dr. J, all of the above are fine. My pronouns are she, her, and I serve as ASTHO Senior Director for Programmatic Health Equity Initiatives and Strategy. And I do a lot of research in organizational development and workforce well-being. These are our aims for the day. This is what we hope to accomplish. So please let me know how I do. I'm always open for feedback, and I'm actually looking forward to learning a lot from you all as I share with you a little bit about what I know. So why am I being asked to come here? Why do I have the privilege of convening with you all? Well, professionally and formally, I operate as an executive organizational hygienist, a professional peacemaker, a strategic disruptor, public health practitioner, chief health equity strategist. But less formally, and a little bit more important, I'm also a big sister. I'm an auntie, I'm a fur mama, I'm a scholar, retired comic book kid. Lots of my ancestors answered prayers, and a proud self-proclaimed nerd. And one of the things I nerd out on are things that impact and affect the workplace specifically. My position and how I show up, I think it's really important for me to provide you all with some of that perspective about how I show up in this space and what kind of human I am. I do this, one, as a way to connect with my audience, even if we're virtual, but also to acknowledge all of what I know is filtered through this multi-dimensional lens that shapes my lived experiences and influences how I show up and how I present and the things that I talk about today. So I show up as a healing vessel from structural racism and political and social oppression. I'm a thriving Black cisgendered woman that chooses not to be bound by strength and resilience. I actually want to create a world where I don't have to be strong all the time, where I don't have to be resilient. I'm a scholar, practitioner, researcher. I represent soul people. I come from a whole line of praying people. We pray about everything. I am, again, extension of my ancestors' hopes, dreams, and traumas. I'm a forever student, so anytime I have the privilege of being gathered with other practitioners, other public health professionals to share what I know, I certainly want to learn from you all as well. I'm a 90s R&B and hip hop music snob. I will argue anybody that's the best music era. And I'm a Gulf Coast, muddy waters, crawfish, smothered root eating, Creole cultured girl. So hopefully that gives you a little bit of flavor, not only about my formal expertise, but also just who I am as a person. And who I also am, I have the privilege of being the fur mama to my little puppy here on the screen. This is little Yasu. I always have to shout her out when I go places because she keeps me together. This is my little house manager and she takes her job very seriously. So I bring her along. She's my co-conspirator in a lot of ways, but certainly takes up a lot of room in my heart. So for all you other fur parents out there, I wanted you all to meet my little fur puppy. So when you hear, or if you've heard the word psychological safety, what comes to mind? What do you think, or what do you know that it is? So drop into the chat. I saw the poll earlier where folks indicated, I think moderately knowledgeable sort of like rang as the top answer among the people who we have gathered today. But just in a few words and a few texts, if you can drop those in the chat. When you hear the word psychological safety, what comes to mind for you? How have you heard it talked about in the past? How have you heard it spoken about? What kind of feeling does it give you? What is it that you think you understand about it? All right, so free to speak up, speak your mind, good. Safe environment to share ideas and concerns. Failure is survivable. Oh, I love that. Let's see. Knowing what to expect at the workplace, freedom to be authentic, predictable and safe responses, growth mindset, really good one, safe spaces, okay, nice. Oh, some really good responses in here. Thank you all. See, there's lots for me to learn from you all too. So safe to share all of who you are without fear of reprisal or recrimination, nice. Safe to elevate concerns, yes. Safe to be one's authentic self. Errors are okay. Non-judgmental. This is great. This is awesome. Okay, so this is good. You all have a really good sense of what psychological safety is. So formally, when I was conducting a lot of my research as a part of my dissertation, I was reading any material I could find on this topic specifically. And the two folks that I ran across the most that I really gained a lot of insight from are Dr. Amy Edmondson and Dr. Timothy Clark. And Dr. Amy Edmondson's definition states that psychological safety is the belief that the work environment is safe for interpersonal risk-taking and that people feel able to speak up with relevant ideas, relevant questions, relevant concerns, or mistakes without fear of being punished or humiliated. So a lot of the things you all dropped into the chat, I think show up and align with this definition. An author, Dr. Timothy Clark, he's the author of a book called The 4 Stages of Psychological Safety. And when you registered, you should have received a resource list, and that book is notated on that list. If you didn't get it when you registered, you'll definitely get it in the post-event materials. But I love the book because it really provides a great practical hands-on guide that shows how leaders can build psychological safety in their organization, because concepts are great. You know, we get a lot of concepts in public health, but I'm always eager to identify some resources that'll give me the how, the hands-on. What is it that I can do? What can I activate around? So I highly recommend this book. But as a sneak peek, I wanted to include the main concepts that are elevated in the text. And there are these 4 stages of psychological safety. And the author essentially argues that individuals in environments move through these stages, and that the movement through these stages can be forward or backwards, and that in a lot of ways it's very linear. I have not studied this specifically, so I have my own thoughts about how linear it may be. But the author suggests that folks sort of navigate and move through these stages in the environment. And where they are in one stage in one environment may be very different of where they are in another environment. So that first stage in establishing psychological safety that satisfies the basic human need to connect and belong at the level and the degree that feels most appropriate, safe, and authentic to that person, and is accepted by design and the individuals in the environment, is inclusion safety. So this gives people space to talk and tell their story, express their curiosity, verbally acknowledge, and actively respect boundaries. And then policies that are written and that are activated align with these acknowledgements as well. So here it's stating that one of the ways that you can establish psychological safety is to ensure that people have access to an environment that is inclusive and that folks feel safe in being included. The second stage to establishing psychological safety is learner safety. And in this stage, you're creating an environment where organizational learning is encouraged, celebrated, valued, and invested in. I always add that invested in part because we can say, oh, you can learn all kinds of things if you really try. Well, it doesn't hurt to give people some incentive to continue to grow and to continue to learn. So this might look like professional development resources and with autonomy. So I understand organizations have different policies. Sometimes professional development resources, because of the source and where the funding comes from, can only be restricted to providing support for someone to advance within the job that they are currently in. But if there are other creative ways that leadership in the organization can work on opportunities for staff to explore interests that are related but may not be directly connected to their actual job, again, that's exercising that growth mindset as an organization, creates more inclusion, and reinforces the value that people have in their staff's interest. In this stage, you value honesty over correct answers. So saying, I don't know, when you don't know is okay in a learning environment. You don't assume competency. So it's safe to ask why or how questions. And the person who's asking those types of questions are enthusiastically supported for making the inquiry. So, they're not made fun of. You're not short with people because they're like, I don't quite understand that. Why is that the way that is? Also, it allows you to identify what is learned when mistakes are made. And that was noted in one of the responses you all provided, that psychological safety to you means that it's safe to make mistakes. And so here in this stage, you're acknowledging that making mistakes is really a part of the learning process. You don't know what you don't know until you know it. The third stage in establishing psychological safety satisfies the basic human need to make a difference and offer meaningful inputs in meeting discussions, projects, and organization-wide convenings. So this may look like empowering staff with guidance and encouragement to exchange for efforts and results. Team thrives under outcome accountability. Without it, the author argues that members of the team will feel like just bench warmers. I'm not able to contribute. I'm not able to share my ideas. I'm not able to question, why things are the way that they are and then offer a different alternative. We aren't able to sort of reimagine the public health practice or, our department or our team and how we function. So in practice, this also might look like asking for permission before giving feedback. So say you're doing a one-on-one check-in with one of your direct reports. And this could go either way, honestly. If the direct report has some feedback for their supervisor, or if the supervisor has some feedback for their direct report. One of the things you might do to activate sort of a nice temperature check and to slowly move people into a space to be in a posture to receive critique or criticism is to say, I wanted to gather with you to see if I can offer some feedback on a part of the project that I contribute to. I had some thoughts and ideas and wanted to know if you had time to hear those things right now. That would be having an exercise in contributor safety. And again, all of these are best activated when it's reciprocated. So none of what I say today is one directional. it's all directional. This most effectively, to create a psychologically safe environment is when everybody is participating. And then the last stage in establishing psychological safety, according to Dr. Timothy Clark, really reigns as the Holy Grail, and it satisfies the basic human need to make things better. And a lot of times, to make things better, we have to challenge status quo. We have to challenge what's there. So here you're providing and giving protection in exchange for candor. You're voicing to speak up when there is an opportunity to improve. You disagree productively. So what I am not offering here is a license for folks to just continue to sort of complain and argue about every single thing to impede progress. That's not what I'm talking about. This is productive disagreement. So how do I productively disagree? Well, maybe I've been supporting a project. I have a certain lens and a certain perspective and something to offer. And I want to challenge how we've been, operating with a partner, or how we've been coordinating the agendas for our coalition meetings. And I have a different idea. Well, it's a good idea to book in your complaint with a compliment and understanding and level setting of where things are, the complaint, critique, or the modification, and then a solution to activate that. How might you contribute to that change? How might you lead that change? Where maybe have you seen examples where that change has been activated that you can sort of pull from to further support understanding of why you're making the suggestion around the change and why you're challenging how things currently are. So other ways that leaders specifically can establish psychological safety in this challenger stage is asking for the bad news. And please don't miss this part. You're asking for the bad news, or if you're asking for any kind of feedback, even if it's not specific bad news, be ready for the responses and sort of ready yourself that the feedback you get, you might not like, and that's okay. Gain your composure and be mindful not to react, but to respond. And there's there's a difference between reacting and responding. Be thoughtful, in those responses. Otherwise, you could disrupt psychological safety. And having a staff or a team go silent, that's not a demonstration of a psychologically safe workspace. I know for some people, psychological safety can sound incredibly fluffy. But in reality, it's really not. It relates to a culture of respectful disagreement and raising important issues. It's really not meant, again, to give license to chronic complainers and those who like to argue just to disrupt any and all progress. It tends to remove the fear of having to face negative consequences when you are speaking up. And when we're talking about building a culture of equity, having a speak up culture is a very important component, a part of that. Quite frankly, it's a mindset shift to think about feedback, whether you like it or not, whether it's positive or negative, in a way of thinking of it as gifts. People have exercised some level of bravery or have some level of psychological safety where they felt like they could trust you with that information. So receive the feedback, as a gift. So we're going to watch this video. You're going to hear directly from Dr. Amy Edmondson herself, and then we'll do a little bit of polling to gauge where you all are at, what you're understanding, and if anything that I said on the previous slide made any sense to you all at all. So we'll watch this video.
One of the most important factors in delivering safe and effective care is psychological safety. Allow me to define that as a belief that the workplace is safe for speaking up with ideas, questions, concerns, and even mistakes. And it's a sense of confidence that your voice is valued. You can think of this as a sense of permission for candor, that the workplace is somewhere where we count on your voice being heard, because you never know when you will have had the observation that someone else missed that will be mission critical to delivering safe, high quality care. Now, I want to be clear that psychological safety is not about being nice. It's not about holding back on something you think might be unpleasant. In fact, quite the opposite. It's about candor. It's also, of course, not freedom from conflict. When you're in a psychologically safe workplace, there will be conflict. People will have different points of view, and we'll get into it, and we'll seek to understand each other's views better and come out with a better solution. Psychological safety and a psychologically safe workplace doesn't mean that all of your ideas will be applauded. And it's certainly not permission to slack off. It's not a license to whine. It's not oversharing. We still want people to be thoughtful and considerate in sharing work-relevant content. And important to mention, psychological safety isn't the goal. Psychological safety is a means to the goal, and that goal is excellence. That goal is commitment to high-quality care. So it's important to recognize that for really high-quality care, you need not just psychological safety, you also need urgency and commitment to excellence. If you don't have either psychological safety or a commitment to excellence, then you are working what I call the apathy zone, where your heart isn't in it, you don't much like your colleagues, and you're just not giving the work what you could give it. And certainly if all you had was psychological safety and no commitment to excellence, then you'd be in what we call the comfort zone, where it's quite a relaxed state of affairs. I know that that's not characterizing care delivery today. However, this is the one that worries me. When your commitment to excellence and your sense of urgency are high, but psychological safety is low, I call that the interpersonal anxiety zone, where your commitment to excellence is thwarted by not feeling that your voice is welcome. So finally, if you have both psychological safety and a commitment to excellence, that's the learning zone, that's the high performance zone. That's where problems get solved day in and day out, especially in healthcare delivery.
So lots to reflect on from that video. So we want to hear a little bit from you all in the in-session polling questions. You all will also get the links to these videos if you care to dig in and dive in later after today's event. So I believe this is going to be the same Slido link as before. If not, go ahead and take a picture. Autumn has dropped the direct link into the chat as well. So which stage of psychological safety do you find yourself in most often? Challenger safety. Nice. You're in the Holy Grail zone. Okay. Leveling out. Learner safety. Okay. Nice. You're in an environment where you can ask questions, make mistakes, be curious. Great. I see some inclusion safety. Okay. Nice. A little bit on contributor. All right. We got 133 folks in here. I see 49 people have participated. Anyone else want to get their response represented? Give you a few minutes in case people are having a hard time maybe getting to the Slido. Okay, I see a few more joining, so I'm gonna hang on in the awkward silence of it all. All right, my ticker has kind of stopped. All right, so learner safety seems to be the place where the majority of us who are gathered today find themselves most often. Similarly, what stage of psychological safety do you find yourself in least often? Okay. Okay, we're starting to. All right, challenger safety by a very long spread is coming up in first place. All right. And I sort of expected that. I don't know that I had any expectations in the first one, but this one can be tricky, especially when we think about, because, you know, challenger safety really doesn't care about hierarchy. And so many of us work in organizations that really care about hierarchy. And I'm not here to suggest that hierarchy is not important. I'm not going to go that road today, but that when not exercised properly, and it can really disrupt the ability, again, to establish psychological safety at the level of challenger safety. Interesting. Well, what I want to do in this session is utilize the stretch framework as a method to do some practical thinking and practical assessment of these concepts. And I will invite you all to drop things into the chat as we run through these different concepts. As Jessica shared earlier, our conceptual model is really this conglomerate of lots of really high functioning and high valued frameworks that we really sought out to help develop this framework. And one of those was the FSG model that really talks about systems change. And the FSG model suggests that it's really about shifting the conditions that are holding the problem in place. And essentially, our framework is designed to provide some practical examples and some practical activation points to help guide people and how to shift the conditions that are influencing systemic operations and make these structural, relational, and transformative changes across these specific domains. So that's as far as I'll go in terms of reiterating the framework, because Jessica did so well earlier. And there won't be a test on this, so you all could reach out to us later if you need more details. So this first one again, what I want to lift up is the difference between what I'm noting as a fragile work environment versus a safe environment, one that is driven and led by psychological safety. So I have some fragile versus safe environment notes on each of the slides across each of the 4 stages of psychological safety. And our where I'm going to be pulling our scenario from is going to be related to that first domain in the stretch framework around community-led approaches. So let's say you've spent 2 years working on a public health policy initiative that focuses on neighborhood safety and accessibility infringement. There have been complaints and things that folks have lifted up in the community around lack of wheelchair ramps, around the doors not being wide enough for folks to get in and out into public spaces and public domains, around maybe the handicap buttons even not working in some places. Not all signage also being inclusive and having Braille available for folks. In the past, there's been community disempowerment in response to different uprisings. Concerned citizens and partners represented on the coalition that's been supporting this initiative cite abuse of power and unfair structures of authority, as well as in all of this that's happening. There's been a lot of turnover being experienced in the health department itself, and that's impacting the coalition's dynamic, who's been working on this policy initiative for the past 2 years. So Autumn's going to drop in a snippet of that scenario that I just overviewed, just for your reference. But in the chat, note some things based on what you've already heard today or what you might have known before coming today that can help to establish inclusion safety in this scenario. And as those things populate, I'm going to kind of overview in the background the difference between what a fragile environment, how that response would be in this scenario or any other, versus a psychologically safe environment. So in a fragile environment, sometimes people can experience where leaders might be hiding behind their title or hiding behind their position or authority, and sort of having a because I said so sort of attitude. This environment's very fragile because it doesn't foster open communication, doesn't foster candor, doesn't foster an open mindset. It might be even fostering a lot of turnover. Sometimes leaders can be more focused on looking for ways to identify compliments and admiration over acknowledging what real problems are. We all like to be complimented. I'm feeling really good about my blazer today. I hope you all like it, but that is not why I was gathered here today. I was gathered here to share with you what I know about psychological safety so that I could help support your workplaces. So while it might be nice if somebody's like, hey, I like that blazer, that is not why I was asked to come and speak with you all today. A fragile environment may also have individuals who ignore or belittle team members. Oh, and they're the compliments. I promised I wasn't fishing for them, but it does feel good. Thanks, though. A fragile environment may also ignore or belittle team members. So folks' voices may not feel like they are heard. In a psychologically safe environment, folks express gratitude and appreciation often. So you're hearing, thank you so much for getting that workout on time. I really appreciate you all meeting the deadline. Doesn't flaunt perks or status symbols. It's really about centering the team. It's really about lifting up the team. So in this scenario specifically, if there has been some community disempowerment and there's someone on the team that's really been hitting the pavement, to have one-on-one or small group conversations to understand the dissent from the community a little bit better and to be able to forge a pathway forward, celebrating that in the next meeting update, not just breezing right past it. Also, folks are active on the team when they feel psychologically safe. So again, in thinking about our scenario, what are some thoughts that you have that would help ground some inclusion safety given these particulars and these circumstances that I lifted up in this make-believe scenario that I know would never happen in real life in public health, because in public health, everything's perfect. Everything's easy. You all have it easy. So what are some things that come to mind? Let me hear from you all in the chat. What are some ways that you think you might establish psychological safety to make sure the folks that are engaged on the coalition feel safe to belong to the team, that they are comfortable being present, that they don't feel excluded, and that they feel like that they are actually wanted, not like, hey, you're just a number, we need to get this work done, we need to check this box, you're here to help do that, and that's it. So what are some ways to sort of flip the script on that when we think about inclusion safety? Any takers? Let's see. Create opportunities to have listening sessions. That's a really good one. Call in the disempowerment from the past to acknowledge the history and be intentional about how to better move forward. Danielle, you are going to be my favorite today because the number of times I talk about how important it is when we are doing health equity work, when our position there is to advance health equity, how important it is to start with the acknowledgement. We have to name the harm. We have to name the trauma. In a lot of ways, that also helps to establish and create psychological safety. We cannot be blind to what has happened and what has harmed, and then expect people to be enthusiastic about jumping back in the ring with us to help push things forward, or to even trust us. I mean, it's so important. Thank you so much for lifting that up. Asking people to volunteer for initiatives of interest, certainly. Giving them the resources that they need when they're volunteering to do that. Invest in and reinforce relationship-centered communication. I love that language. Relationship-centered communication is so important. I mean, certainly all of us have days when we're super busy and there's stuff just piling on and it's like, oh my God, I just need to get this out so I can move on. And I get how that feels. However, the lasting effects of being short with people, or being a little too pencil whipping, or being a little bit too direct in a way that is off-putting and doesn't help to establish the relationship can have long-lasting impacts that affect the work. Now, if you're building a relationship and you and that person, y'all both just have more of a direct personality and that works, by all means, lean into that. You know, it's not a one-size-fits-all in terms of centering a relationship. Trauma-informed training. Kendall must have read my notes because I'm going to get to that later in my presentation. Empowering individuals by asking good questions. Invite the quieter voices. I love that, Princess. And one of the ways, well, a lot of ways you can invite quieter voices. Have multiple ways for people to give you feedback. Not everybody wants to stand up in a meeting and, you know, get their thoughts out. Not everyone's most comfortable Not everyone, folks sometimes just get distracted, in their thoughts and trying to, communicate what their point is. Give multiple opportunities for folks to provide that feedback. So moving on to learner safety. In a fragile environment, leaders might hide mistakes, may not say they don't know. And not just leaders, everyone, in this environment may be more likely to hide mistakes, say they don't know, be unwilling to listen and or ask questions. But in a psychologically safe environment where learner safety is centered, people feel comfortable admitting mistakes quickly and willingly. So, the longer you're holding on to the mistake, sometimes things can be made worse. So quickly acknowledging those things, asking more than they tell, and dedicates time and resources to learning. So let's say we have a scenario where the health department received some funding to implement lead poisoning prevention programs. And historical and present day redlining practices promote residential segregation and resource disenfranchisement. Residents hear about environmental hazards on the news and they believe they've been lied to and that information is being suppressed. The highest lead exposure is found in low income and public housing areas. So giving that scenario, and again, Autumn's going to drop that in the chat in case people want to have a closer look at that. What are some ways among the health department staff that are noted in this scenario who are leading this lead poisoning prevention program? What are some ways that they could reestablish psychological safety at the learner stage? So this is advocating for members' ability to learn through asking questions. Team members may be able to experiment, make and admit small mistakes, and ask for help. So we have a situation where there's some historical trauma that's involved in terms of how this program gets designed. And to me too, this scenario also points to lack of trust. So there's some distrust here. So what are some ways where you can activate learner safety by trying to execute this place-based initiative in thinking about the difference between a fragile environment versus a psychologically safe environment? Let me hear from you all in the chat again on what some of your thoughts are. I think I missed a few from earlier. Well, Michelle, I think your comment may also be suitable here for this stage, welcoming input on people's own schedule. Not everyone thinks the same at the same time. That's a really good one. Sometimes people need to marinate, on stuff. I know sometimes that works best for me. Again, the acknowledgement of the historical harm and the role in that. So yeah, it may not have been you that sort of activated the dissent, but you represent an entity that hasn't left a pleasant taste in people's, memories or in their minds. Invest in training for leaders at all levels on leading with a coach approach. I like that. To empower individuals, create a learning culture. Nice, we've got a resource here. So folks make note of that. Coach the person, not the problem, by Marcia Reynolds. So if folks are interested in more things there, that's really important, that language around coaching versus managing. My own personal opinion, I don't think you can manage people. And I know a lot of folks will probably argue with me about that, but I'm like, people gon' people. Like, I don't think, we can manage a thing. I don't think you can manage people, but coaching, empowering, leading, those types of things, I think are a little bit more realistic. And for me, that language really matters in the difference in those things. So if we think about workforce development, and we're thinking about contributor safety. So in this scenario, the health department is actively working to establish an organizational sustainability plan because they want to increase the number of CHWs that are within their workforce. Anonymous feedback from staff, existing and past contractors cite lack of diversity and inclusion as one of the problems in the health department. Leaders are not sure how sustainability will be realized without securing adequate funding for certification and ongoing training. Discourse among the core team who's developing this plan regarding how to design the composition of the workforce, criticize the current recruitment strategies that they believe should not be a part of this plan. So again, Autumn's going to drop that scenario in the chat just in case you want a closer look and to think about that. But when we think about contributing, you got this core team together and we're talking about increasing our workforce to be more representative, to include CHWs. The development of this plan, to spend any time towards that, is communicating that by and large, the organization recognizes the value of CHWs in the public health workforce. So what are some ways to secure contributor safety? Well, in a fragile environment, folks might be more likely to steal credit or refuse to ask for help or do more micromanaging. So, where some of this feedback that they received in an anonymous survey that cites lack of diversity or inclusion. In a fragile environment, people may be very defensive about things like that, or may make comments that reinforce and reiterate some of the reasons why lack of diversity and inclusion was noted. But in a psychologically safe environment, folks are more likely to recognize accomplishment and give credit where credit is due, ask for help, offer new opportunities to contribute, and let people do things their own way. And I get how scary that can be, especially if you are a leader or supervisor, especially if you're supervising multiple people. You're like, just do it like this because I can't think of anything else. I'm overwhelmed, just get it done. And I get that. However, it can really be stifling a lot of creativity and autonomy. And in the long run, that does not communicate that, hey, we really value your input. We value what you bring to the team. We value your unique perspective. And we look for ways for that to show up in the work that is produced here so that we can also reinforce for you your value in public health or in this team or in this department. So what are some ways that we can establish psychological safety in securing more contributor safety? And this involves, members, again, feeling safe to contribute their own ideas without fear of embarrassment or ridicule. I mean, it looks like there's some discourse here already, and discourse is not necessarily bad. There is a way to facilitate healthy discourse. I would argue that it's quite necessary if we are going to reimagine, how we do things. So what are some ways that you think that you can secure or establish contributor safety given some of the details of the scenario? Let me hear from y'all in the chat. I hope I haven't confused y'all. All right, I see something coming up. Standardized regular team conversations about improvement opportunities. I like that show leader and team receptiveness to ideas from all and have collaborative processes for prioritization and testing. I love that. That is a really, really great idea. I mean, that solves a lot of issues that were raised in this scenario. And I also like the nod to, hey, how about we use some quality improvement processes to help guide and help activate the feedback that we're getting from folks. So thank you so much for that. And here we are with challenger safety. And we have 5 domains and 4 stages of psychological safety. So I put finance and data driven management together, mostly because challenger safety is often the one that is most challenging to establish. But in this scenario, the health department and their community-based organizations are partnering with a university school of mass communication to launch a storytelling campaign. And for them, it's a way to report some qualitative data sets that they have. Leaders are urging the health department staff that are working on this campaign to activate more braiding and blending of funding streams so that they could sustain progress and programmatic capacity. They also want to utilize this initiative as sort of an example to help establish some lessons learned to guide other programmatic work across the organization. Currently, they are plagued by siloed funding mechanisms, uncoordinated infrastructure protocols. Some of the leads have been stifled of how to proceed following the review of a public opinion survey that cited the health department lacks cultural humility and other feedback that suggests that there's some distrust, some bias, and misinformation influencing the public dissent. So once again, thank you, Autumn. She's going to drop that into the chat in case you need to reference that. But again, we're talking about challenger safety here. This is where members have some freedom to question others' ideas or suggestions, to have and practice more of that candor. According to Dr. Timothy Clark, you don't necessarily lose the safety that has been established in these other stages. So by the time you get to challenger safety, inclusion safety should be established, contributor safety should be established, learner safety. So you get to challenger safety, all of those characteristics from those other stages are brought here so that members feel even more comfortable with asking those questions, pushing back and challenging norms. But in a fragile environment, nothing can be challenged. Really in a fragile environment, the only thing that's safe is the ego in that environment. Psychological safety is going to lose out if ego is operating too much in that environment. It's an environment that really promotes people to never admit their personal failures, never admit if they don't know something. And it often has this practice of shooting the messenger. Look, this was from the survey. I did not say these things, but we have to grapple with this feedback that we got from the public, especially since we want to launch a broad-based storytelling campaign. We have to be knowledgeable about those things. Again, we talked a lot. I saw comments in the chat about acknowledging past harms. We can't ask people to fill out our surveys and then get upset about the feedback. But in a psychologically safe environment, we're asking for direct feedback, and we're asking for it often. We're designing our meeting time around feedback. We are also designing some systems and processes in place where feedback is actually being utilized. So it's not going into a black hole. It's not staying, static in that meeting that happened last week and, oh, we're off that now, we're moving forward. We are utilizing the feedback as a way to continuously improve. We're encouraging innovation and exploration. So, it might involve hosting some town halls maybe to hear more about this public dissent that came up in this public opinion survey. It may even involve getting the community with a seat at the table in designing this storytelling campaign. And then lastly, a psychologically safe environment that has challenger safety really rewards the vulnerability of challenging the status quo. Maybe there's a way that you all have done it over and over again, and maybe it's worked, but leadership and team members are really enthusiastic about challenging current norms. And I see a comment in the chat, meeting the public in neighborhood safe spaces where the public can come together and converse with the health department and the university and community leaders. Exactly, going where they are. And also humbling yourself to waiting for an invitation to come into their space. So maybe it's not us leading and dictating when the meeting's gonna start, what the agenda is gonna be. Maybe it's tucking our tail a little bit, going to these different community groups and asking, can we be added to their agenda? Because there's some things we want to hear from, and let them drive and let them guide us. So I hope some of this practical application thinking was helpful for you all. I'm gonna quickly go through the last part of my presentation where I'm gonna focus on some leadership archetypes and its relationship with psychological safety. So as promised and was brought up earlier, trauma-informed approaches is really important to me as a researcher, but was very interesting to me to explore in terms of leadership specifically. So things like safety, we've talked a lot about psychological safety today, of course, but this is psychological safety, physical safety, a whole gamut of safety. Also, a trauma-informed leader is trustworthy and transparent. And I want to give a caveat a little bit on this transparency piece, because this comes up a lot in terms of discourse and miscommunications that happen in organizations. And overall, I think most people are pretty reasonable, when we're talking about transparency. But sometimes, we mix up transparency with being this, free-for-all. And not all information is a free-for-all. There are some confidentiality restrictions on some of the information we have access to, and that can only go so far. However, I think the way that we can be reasonable about our expectation around transparency is really thinking about the use of the information and what impact it's going to have on our specific outcome. It requires a lot of trust, because there may be information that you might not be privy to, but having trust in your leadership that they're protecting that information for a good reason, but also able to drive with that context in mind to support the work that you're doing. Peer support is also big in being a trauma-informed leader. This is both giving and holding your posture so that you can be in receipt of peer support. You know, having the ability for folks to come and say, hey, is everything okay? Can I help and support you on that? And then also you returning that. Collaboration is big here too. You're not going to know what's going on and where people's temperature are if you're not practicing and being collaborative. Empower voice and choice. So again, that feedback thing, we're asking people their preferences, their feedback, what they think, allow their voice to be heard, and expect that there may be different choices, and empower that. And then finally, we talked a lot about this, but I'm going to keep reiterating it. Acknowledging, naming, seeking to reconcile and dismantle cultural, historical, and any demographic-based discrimination and bias is also another key approach that trauma-informed leaders exercise. So additional information about trauma-informed leaders is that they accept that people, including themselves, will struggle. So, I mean, adulting sometimes is ghetto, as I'm sure you all know. It's not always fun. And so with that in mind, there's a certain amount of stress that we can sort of expect that will be a part of our regular adulting lives. But there also could be some stress that we suffer from past and other current traumatic experiences. And what trauma-informed leadership says is that leaders must be both competent in their skills to navigate challenging situations and compassionate in their actions towards things that impact their team members. And that compassion is really, really important, because everyone responds to changes differently. And sometimes other people's reactions to a change can either seem over exaggerated or under exaggerated. And we have to be compassionate to all of those things, because as I said earlier in my positionality statement, I shared those things with you all because I wanted you to know where my position was. I wanted you to understand, before I go through any of these slides, this is where I'm coming from. This is how I see the world. This is what has influenced my view of the world and my lived experiences. We all have that. If we all did a positionality statement or slide, they would all look different. And so it's important to practice compassion to how people are reacting to different changes or different things that are happening within the organization. And it's important to understand if you have the ability to practice that compassion in the moment. The answer to that might be no. You might need to go take a walk. You might need to go drink some water. You might need to eat. You might need to close your eyes for 7 minutes or whatever the recommended time is for a nap. I always take naps and they're way too long, and I wake up confused thinking I'm in year 30, 35. I'm like, wait, it was only supposed to be a few minutes. But whatever that is, so that you can reground yourself and lead with compassion, is also going to reinforce a psychologically safe environment. So leaders who practice trauma-informed approaches, they are more likely to align and have and activate their emotional intelligence. So leaders' emotions often have this multiplier effect. Leaders have a lot of influence, both the direct things that they're doing, the things that they say, and the things that they don't say. In a lot of ways, the team is modeling what they are being shown among their leaders. So all of this is important. And more leaders that are practicing and exercising compassion, you may likely begin to see that other people will start exercising and practicing compassion for others as well. And it becomes this really positive domino effect. But in the same way, if there's no compassion being led, by the leadership, then that might communicate well, in this environment, having compassion for others is not important. It's not a value. And so that might be an environment that feels a little bit less psychologically safe to others. Traumatic stress can overwhelm people's ability to cope. It leads to burnout, exhaustion. I don't know if any of you all relate to this, if whatever part you played in responding to the COVID-19 pandemic, but we saw this a lot. It can even deteriorate behavioral and physical health. All of this has a direct impact on the things that we want in terms of the organizational outcomes that help support the goals. Creativity, high functioning, high performance, psychological safety, productivity, and just an overall ability for everyone to thrive personally and professionally in that environment. And this applies too when we're, engaging in the community and working with our community partners. That is an environment where we should also be focused on practicing compassion and securing a psychologically safe space. Another characteristic of a trauma-informed leader involves cultivating trust. Cultivating trust is immediately actionable when individuals are honest, when they're reliable, and once again, compassionate with their interpersonal approaches. But all of this weighs on your ability to practice self-awareness and be able to name, where am I? Where am I on my spectrum? Am I in my cranky mood? It's okay to be cranky. Being mad is not a bad thing. It's how we either react or respond to that anger. And maybe the response should be, I got a little bit of an attitude. Let me shut my mouth right quick before I say the wrong thing. Take a beat, and then let me get back to you. And that is very good practice, because we're humans. We are not expected to, be on and always be at the ready. It's unrealistic. We're not always going to be in a happy-go-lucky mood, and that's okay. It's reacting out of that anger, or maybe that unpleasant version of us that causes this unpleasant domino effect. Another characteristic of trauma-informed leaders, they're really good at disrupting toxic stress. So, I had a situation where there was a lot of leadership changes happening all at once. It was really my first time being in a supervisory role where I was supervising multiple direct reports, and all these changes were happening. And for a lot of the people who were my direct reports, this was their first professional full-time job. And so change and things shifting, getting new leadership, having policy changes, even having reorganizations was very scary for them. And I had to be compassionate to that. So I couldn't, sort of ignore their fears that they were expressing to me. I couldn't say, oh my gosh, I was being so dramatic. Just chill out. It'll be fine. That is not going to reinforce any level of confidence in anybody. So I had to take a beat myself, because it was a little bit overwhelming. I had not experienced it before, but I created opportunity to have one-on-one dialogue. I collected their feedback, really tried to be a great listener of what was motivating the fear, and then synthesize that into a structure and a strategy focused sort of dialogue, so that I could then take that information and have the conversation with the senior leaders so I could get more understanding. Because quite frankly, a lot of the things that they had fears about, I didn't have all the answers to. But what I appreciated is that, again, they trusted me to, one, share that information with me, and then they also gave me the responsibility to do something with the information that they shared with me, so that their concerns could be heard, so that they could feel more grounded in some of the changes that were happening so quickly for them. So disrupting that toxic stress, because they were distracted, folks were not focused. And if folks if their day is being disrupted by toxic stress, they're not being creative, they're not being innovative, they may not even be that pleasant, to partners or other folks that are working, on the work with you all. None of that is going to get us to our goal. And finally, overall trauma responsive engagement is also a key characteristic of trauma-informed leadership. This involves a commitment to multifunctional approaches to monitor for and also eliminate trauma, including different interactions that negatively impact their overall mental health and their well-being. So this involves things like, again, that acknowledgement, acknowledging the change that's happening, becoming a catalyst for cultural change or cultural humility and support. Because sometimes maybe that change really isn't a very good idea. Maybe there are some consequences that may not be as relevant to the folks who are making decisions, and you can be that catalyst to say, hey, here's, you know, a blind spot that was raised. How are we going to account for that? How are we going to reconcile that? Putting in the work to create some paradigm shifts. This is really exciting. I love paradigm shifting and mental model work because, you know, things like equity, psychological safety, being a trauma-informed leader, you know, it's hard sometimes for people to sort of understand, okay, well, how do I know I'm doing equity work? Or how do I know I'm establishing psychological safety? Even if they're, you know, you attended this session today and I'm giving you a lot of tools and indicators of that, but like, what does it feel like? It's a paradigm shift, and paradigm shifts sometimes take time, and not everybody's going to shift their paradigm at the same time that you are ready to shift. And so that's where we get the opportunity to practice some grace. We get the opportunity to, as we continue to try to move forward and progress, we also acknowledge the reality. And so maybe the reality is we need to slow some things down, not take our foot off the gas pedal completely, but let's slow some things down so we can allow some folks to, you know, catch up to where we are and to create some additional buy-in. All right, so one thing I want to do very quickly, I had talked to you all about briefly about establishing a culture of equity. So here is a conceptual model that I developed, actually a part of my dissertation. And one of the things that I was trying to do is to understand what are the components that help build a culture of equity. And so in the center of the diagram, this is where I lay out some artifacts. And so these are essentially what do things look like that communicate equity in an organization? Might be things like policies, the work setting, interpersonal interactions. Then what are some of the values or the beliefs that are lifted up and also acted upon within the organization that would communicate a culture of equity? And this can vary, you know, across organizations, but what came up the most out of my research was around fairness, respect, and belonging. Over and over again in my quality analysis, these themes came up the most. And then that bottom part of the triangle in the center of the diagram talks about shared assumptions. So these are things around protection from harm, mattering at work, work-life harmony, opportunity for growth, and connection and community. These basically serve as our grounding foundation, the things that we're going to build everything else off of. And I suppose this could vary too by organization as well. But what's key here is all of these components that are being associated with and that are building and that we're acting upon to sustain this culture of equity is enveloped around psychological safety. So what does that mean? That means there's candor even in how we establish what it means in our organization to have a culture of equity. And I won't focus too much on the right side of the diagram, but on the left side is what I wanted to lift up in these leadership archetypes. When I was doing my research, I found that these 5 leadership archetypes did 2 things. They were more likely to exercise trauma-informed approaches, and they were also more likely to be facilitators of psychological safety. Now, this is not an exhaustive list, but for those of you who are curious or interested in terms of like, okay, well, what leaders are most likely, or what kind of characteristics are associated with leaders who are most likely who do this well that I might be able to look up later and get some insights from and model in my own leadership style. Servant leaders came up a ton. Also interactive leaders, those who had very strong interpersonal skills and were really activated compassion. Motivational leaders. So these are leaders who are really big on empowering their team and reinforcing that empowerment and utilizing that empowering environment to promote results. Inclusive leaders. We talked a lot about inclusion today. So these types of leaders really value the core values and the opinions of everyone on their team. In a lot of ways, inclusive leaders really ignore hierarchy altogether. And then finally, transformational leaders. So these are leaders that very much are comfortable with change. They are comfortable leading change. They are comfortable being a part of change. But most importantly, they are comfortable with changing themselves. And so they demonstrate a great model for how other people can make changes when things are happening culturally within the organization. Michael, I'll give you the share privileges back because I'm going to go to the next slide. But again, I shared that just to give sort of a broad scope of what types of components might look like in terms of building a culture of equity, how it's related to what we've been talking about today around psychological safety, and then what types of leaders are most likely to actually facilitate psychological safety and have a more trauma-informed approach. I do plan to publish, so for those of you who are interested, you might see this later in a publication. And so I'm going to share another video with you all that provides a summary of some of what we detailed today, but talks a lot about vulnerability and psychological safety. And then we'll do some polling. And then I'll also invite you all to drop in any questions or thoughts that you're having. I saw a couple of them, but if there's time, I want to get to some of those at the end of the presentation.
I think the word vulnerability scares a lot of people, especially in business. Nobody wants to be vulnerable. Nobody wants to share their weaknesses. Why would I do that? It'll hurt my promotability. I don't want to be humiliated, you know? So I think first and foremost, we have to define what it means. This is why I like terms like psychological safety or circle of safety, that we have to build circles of safety. And I don't need to use the word vulnerable because then I end up having a semantic debate with someone. So when we talk about being in a circle of safety or feeling psychological safety or being vulnerable, what that means is, and I think we have to be declarative about what it means by the way of example. What it means is that I can raise my hand and say, I made a mistake, or I don't understand, or I don't think I have enough training to do the job you're asking me to do, or I need help, without any fear of humiliation or retribution. In fact, I can say these things with absolute confidence that someone will rush in to support me, whether it's my colleagues or my leader. And we've all been on a team where we have that. Unfortunately, we've also all been on a team where you'll never admit a mistake, you'll never admit any gap in intelligence or something you don't know, you'll never admit you don't have enough training, you'll never ask for help because it will get you humiliated or affect your promotability. And so if we can talk about the fact that we've all built like that and we'd rather work in situations like this, then we have to reward that behavior. When you express that you don't know something or ask for help, that's a good thing. Also, I think people make a big mistake where expressing vulnerability is not the same as being vulnerable. Expressing weakness is not the same as being weak. So for example, if you sat in a meeting and you went, I don't understand this. I need somebody to explain this to me. I don't know this, right? There's no way you're inspiring confidence in your company. But if you simply own it, like, hey, I don't understand a single word of this deck. If somebody can please just explain it to me because I'm the complete idiot and I don't understand any of this tech stuff, that would be really helpful. And if you just say it with confidence, if you own it, it's the confidence that's inspiring, not the expression of the weakness. So I think if you're confident in your weakness and you serve as that example, it allows others to do the same, also rewarding the behavior. In other words, when somebody asks for help, recognize, point it out, and say, yes, more of that, please, because I think the incentive structures and reward structures affect people's behavior as well.
Great. So we have a couple of polling questions related to the video and some of the things I covered. So if you take note of either taking a picture of that with your phone or accessing the link in the chat, how often do you exhibit vulnerability in the workplace or business setting? Great. Looks like sometimes is representing the majority of us in the session today. Okay. Right. So I actually had another discussion question here, and I think I forgot to note that. Give me a second here before we move on to the final sort of benefits of that. So in the chat, what does psychological safety feel like to you? I know you all mentioned that you had different degrees of knowledge We talked about sort of like what stage of psychological safety you found yourself in most likely. But what does psychological safety feel like to you specifically? Because the thing that I'm very interested in exploring is that I appreciate, the guideship of, researchers and different practitioners who are exploring this in all different kinds of workplaces. But one of the things I'm curious about is sort of like, again, how does our positionality and our lived experience and how we show up at work impact how we even see psychological safety, and what can be learned from that to help further advance and refine how we work to establish psychological safety. So I see taking risk, making mistakes, innovation, purpose and action, solidarity, empowerment, feels like belonging. That's a really good one. I think psychological safety feels like belonging for me too. Like you can be curious. I love that. Awesome. This is great. This is great. Thank you. In the chat again, how do you recognize psychological safety in others, or do you? What does that look like? How do you recognize psychological safety in others? Culture of all in and equity and sharing. Authentic engagement. Embracing imperfections, because we're humans. We're not gonna get it right every time. Nice. And everyone's light shines bright. They own their mistakes. Yeah. What a colleague can share, something personal. When people share crazy ideas, yeah, because we all have them. And often those crazy, wacky ideas catapult us to a whole other dimension. Intentional assessment of surroundings and feelings. I love this. Awesome. Well, good. Well, I feel like I made a little bit of sense today. You all at least are providing responses to the questions that are on par with today's discussion. I'm going to wrap up really quickly here with talking about some of the benefits, many of which you all have named in the chat already. But humility, framing the work builds shared understanding of some of these complex and uncertain or novel, natures of the work. Makes it clear why everyone's voice matters. So we all don't know everything, nor do you need to be the single holy grail knowledge holder. So practicing some humility in there, it's easier to do that when you're in a psychologically safe environment. Curiosity can really thrive in the environment. And then most importantly, I think empathy, responding productively, and having appreciation, listening, and focusing forward, but having a lot of compassion for what people are feeling, and creating, a safe space for that. And then finally, research tells us that some of the effects of psychological safety include, and you all have mentioned a lot of this, more speak up culture. So you'll get more feedback, which is great. A silent organization really shouldn't be any leader's goals. My goodness, if you can't hear from your comrades that are right under the same, umbrella with you, how do you have any real visibility of what's going on at all levels across the organization? Another effect is commitment. You're more likely to retain really good talent, for the organization, which is really good about achieving goals. Higher quality and higher performance, more productive performance is experienced in psychologically safe environments. And then again, promoting this learning and engagement environment where questions are welcomed, curiosity is celebrated, innovation, there's resources and time and space and empowerment around innovation takes place in the environment as well. So we have a few post-session polling questions that we'll get to. And then I'll open it up for Q&A, and I think Autumn has been grabbing some of the comments and questions because there's lots of stuff in the chat. I'll try to scroll up as best I can. But rate your knowledge or skill in psychological safety after today's convening. Okay, moderate, very knowledgeable. I think earlier moderate took the lead, I believe. Y'all keep me honest. So this is nice. All right, we got about a third of the participants participating in the polling. Right. So on the higher end, that's good. I said something today that made sense. That makes me feel good. I certainly don't want to be talking to a room and confusing people. You certainly don't need that as a part of your day. Awesome. All right. Next question. I will be able to apply the knowledge I gained from this convening directly into my work. Strongly agree, agree, somewhat, disagree, strongly disagree. I hope there's no strongly disagrees. Oh my gosh. We all have power of influence. So even if it feels like you don't, we do all have power of influence. Awesome. All right. And then this is open-ended, so I'm going to have fun reading these. I hope the screen doesn't move too fast. Please explain how today's convening can advance your organizations or your collaboratives, your coalition, whatever group you're representing, how it can help to advance your equity work. So this one, I'm looking forward to some of the responses here. And I see folks typing, so I'll give you all a minute to get those going. And again, if you have questions that you didn't already drop in the chat that you have, please drop those in. I'm going to try to get to as many of those as I can. So it empowers me to trust myself and to keep going. That's great. I'll bring this training material back to the organization's DEI committee. That's awesome. Always down to share information. Again, reciprocated learning is really important. Empower employees. Shared the slide deck to the equity team, adding this stuff into our staff training. Awesome. Educational material for team members. Awesome. Sharing is caring. This is great. Make safe spaces for people to share. Okay, now they're starting to move too fast. Open space for new ideas and strategies. Share with their team, being able to provide more context, real life examples. Nice. So overall, you all got something today that was of value that you can share with your team, help to inform some existing things that you're doing, and also to share with other groups. That's awesome. I'm glad that it was helpful. The application of psychological safety in community, since the work centers on community. Awesome. Yeah, public health work is, I mean, the spectrum is just so broad in terms of, what actual spaces we're working in. Really validating to see that I practice psychologically safe tactics in an unsafe environment. Wow. Well, hats off to you. Going to keep fighting to support inclusion for coworkers and community. Nice. And don't forget to take a nap, whoever wrote that. Like, do that work, but please rest. Rest is probably your best act of resistance against systems that seek for you to be exhausted and confused so you can't fight back. So do that, but take a nap also. All right, so questions that I could help answer from folks today. In Autumn, I'm going to lean on you a little bit on if there are any that you have to kind of lift up for me.
Yes, I do have a couple of questions. So one that came up early in your presentation from Sam was, would love to hear your thoughts on best practices for repair when we make a misstep and disrupt psych safety, Dr. Justice. In my experience, this is also a critical part of psych safety, knowing we can come back together and learn after moments of failure or friction.
Yeah, that is a really good question. Thank you, Sam, for that question. This presentation, is what, an hour long. I've been talking to you all, and this whole session I think is 90 minutes or so. And I had to squish, just enough information in here to get through this timestamp. So, but what becomes much more complicated is like, okay, I went to this session, you're asking me how I'm going to apply it. The results of that application don't always happen rapidly. And so I say that to say that it is going to require, that repair piece is going to require investment into the relationship long before, as much as you can control, a problem arises or discourse is happening. We got to get some empathetic, compassionate equity already built into the relationship. So it really becomes about prioritizing that in our interactions, in our interpersonal approaches, so that when there is discourse, when there are mistakes made and those sorts of things, it shortens that window, for that repair piece. And also being realistic that, like, yeah, this mistake, I want forgiveness, but also acknowledging how that might have, irritated some part of someone's job, and that being okay, and letting people be in their feelings a little bit about it, but none of us staying in our feelings about it, to a point that's no longer productive. But I think you bring up just a real critical piece, because it's easy for me to sit up here in this presentation and go, oh, we got to be, mindful about, when people make mistakes and be forgiving. Sometimes the mistakes do have real repercussions. And so I would say investing in that relationship development ongoingly, waiting to try to build a relationship with something that's gone wrong. I don't know how, I don't know how great that's going to go. So I would say that that's one thing that comes to mind for me. Autumn, anything else?
Yeah, for the sake of time, did you want to provide answers to the rest of the questions and follow up? But one question I think everyone would be interested in hearing the answer to is, where can we follow you to stay up to date with your journey? Question from Kayla.
Yeah. I don't know, because I don't really do the social media thing like that, but email me ajustice@astho.org if you have follow-up questions. I am exploring and submitting abstracts right now, so I don't even know exactly where I'm going to be published, but I figure my name will probably stand out. So hopefully, you'll be mindful of that. But I am looking at like organizational science publications, as well as public health publications to publish it. I will be at APHA this year, so if you're there and you run across me in the sea of 1,000 people, I'm there. Yes, I do have LinkedIn. I will figure out when I hand it over how to drop my link to my LinkedIn in here, and I'll do that. And then I will also be presenting on psychological safety in October at the Black Doctoral Network conference that's happening in Los Angeles. So I'll be there as well. And then for all the other questions I didn't get to today, I'll have Autumn share those with me, and then we'll do like a FAQ or something where I'll respond to those in black and white, and you'll get that with the post-event materials as well.
Awesome. Thank you so much, Dr. Justice. We appreciate it. And we're going to close out really quickly. As you all start to leave the Zoom, you will see a post-convening evaluation. You can also use the QR code here. If you are in need of a phone or a Word document response, please email fizz@astho.org. Additionally, we do have a stretch network of health equity practitioners online community. We will drop that link in the chat. All you need is a my.astho account to be able to continue this conversation. Additionally, yes, the convening today will be recorded and uploaded onto our YouTube series, in addition to our past 2 convenings that you will also be able to access through this link. And last but not least, be on the lookout for our 4th national convening on finance. More information to come on that particular date. Thank you all so much for joining us, and we will see you next time.